coronavirus first struck in the beginning of the year, it also started actually kind of last year at the end of the year, but when it first kind of hit us here in America that we need to do something and stay sheltered in place, we thought, oh, we're all going to stay home and have a party for a month and not have to work. Well, people did work. Some people worked, and that month turned into 2 months. Some of them turned into 3, and basically we don't even know how to count what day it is anymore. The coronavirus has created this blur of 2020 and doesn't seem to be going away, and it's even become a political debate over whether or not you should wear a mask, and it's really important to get the correct information. So today on Big Blend Radio's Champagne Sunday show, we're going to be chatting with Dr. Jackie. Now, you know Dr. Jackie, full name is Dr-Jacqueline-Eubany, is one of our regular Big Blend experts on the radio shows and in our Big Blend magazines. She is a board-certified cardiologist, an electrophysiologist who taught me how to say that word, and she's also the author of the best-selling book, Women and Heart Disease, The Real Story. You can get it on Amazon, all of the online stores, and I encourage you to ask your independent bookstore to carry it as well. It is womenandheartdiseasebook.com. That is the website to go to for that. And if you're in Southern California and even want to do telehealth, she does that too. You can go visit her Cardiovascular Wellness Institute of Orange County. It's in Orange, California, and in Irvine, California. You can go to cvwellnessinstitute.com. So welcome back, Dr. Jackie. How are you doing?
Good. Thanks for having me. Always great to be on the show with you guys.
You too. So champagne toast to all those who are wearing masks when they go out. Is that right? Can we raise a glass to everybody
Absolutely.
who's doing that?
Yes. I have one right here. A champagne toast to mask wearers.
That's it. Mask wear is everywhere. So because it's champagne and it's lighter and it has bubbles, does that mean we get to have 6 ounces?
No, we still have to stick to the 5 ounces for our heart health, unfortunately. But we can do one a day, which is good, yeah. Exactly.
Oh, we've been very good. We've been very good, haven't we, Nancy?
Of course.
She's like, of course, yes. We've been very good.
Yeah.
We've been doing a lot of driving, let me tell you that, and a lot of walking and a lot of dog walking. So that balances things a lot more. Yeah, so we've been behaving. But it's been interesting traveling and going to different states and also having to turn around from different states because of restrictions or, hey, we're fine, and then 2 days later we're not fine. And it seems like the country is just, other countries seem to be doing better, I feel, but I could be wrong because I don't know what to believe anymore. But I do know that you shouldn't be going wrong by wearing a mask, right? That can't be bad for you.
No, absolutely. A mask helps to decrease the transmission of this virus. We know that the virus lives in your nose, in your in your mouth, in your spittle, and those kinds of things. So when you're talking, you may not notice, but you spew out this virus. And when you're talking next to, when you're close to someone and you're talking and you have these fomites just spewing, the other person is breathing in these fomites. That's a potential for another person to get infected. So the mask acts as a barrier to prevent, these fomites and viruses that you have from going into the air and being inhaled by somebody else. So yes, it can block the transmission of this virus.
Oh, okay. Do you know which way we're supposed to wear it? It's getting confused. Is the blue side or the white side?
Oh, if you're talking about the surgical mask from the hospital, it's the white. The blue side is the part that's exposed to the environment, and the white goes. I don't think it really matters. But actually, good. Yeah, the blue side is the one that you wear that's exposed to the environment. Yes.
Okay. Well, Nancy, we need to go shopping for a new wardrobe then.
Or it doesn't necessarily even have to be a surgical mask. Everyone sells masks these days. I was in Target the other day, and I saw they had like 4 masks for $4 or something like that. Or you can make your own. I've had some of my friends who sew make me a few masks that I can wear, and those are good because they're washable, reusable, and you don't have to keep buying them and throwing them out.
Yeah, we're kind of on the disposable route. We do have a cloth one that says Louisiana on it, thanks to our friends over in Natchitoches. Okay. And you can wash that in your hotel room. But I feel like it needs to go in a hot wash, like hot you have to wash them in hot water to get like if the virus attached itself to it, right?
Yeah, and using just soap that has antimicrobial effects will just kill the virus. So washing it will definitely kill the virus.
One
and then
thing
if you're a
we've
fashionista,
seen,
go ahead.
Go ahead.
I was going to say, if you're a fashionista, you can wear a mask that matches your outfit, and then you can really look cool.
And you can use it for political statements too.
Absolutely. Vote.
So
let your mask say vote this November.
Yes, that's right. Or you could have a pile of money on your mask saying, "Put your money where your mouth is." I mean, you're
wow,
that's gross.
Like that.
Whoa. I don't know, but okay. So the mask thing. One thing we've seen, and this is kind of on the sad side and a true thing. We were interviewing some forest and park rangers the other day and talked about this. We're seeing, because we go to a lot of parks, a lot of rest areas on the road, and that's always scary. But I have to say that, Nancy, wouldn't you say that they're cleaner in the public areas than before?
Yes. And most of them were, every once in a while, not so much, but they're doing a really good job on that. And I think it's valuable because, after all, the people on the road are traveling from place to place. So,
yeah, you got to have your restrooms clean.
Yeah, that's good to know that people are, actually making an effort to clean places to encourage people to come, through and travel.
I think it's better
yes, I think
than
that's a
what
great
we had
idea.
before. Yeah, the one thing, though,
exactly.
from the public is we're seeing masks now become the new form of trash. And it's like throwing your cigarette butt out the window, which we still see people do. Like, stop it. But also the new litter is masks. And, I think that is one of the worst pieces of litter now because animals can still get stuck with the cord thing around it. It could have coronavirus on it, right? And now you're asking someone else to pick up your mask. That is, even though you've got little stretchy things, that's, to me, wrong. We should really be watching that, or does it matter once the mask is off?
Does it matter in terms of what?
Is someone else picking up someone's mask because the other person dropped it on the side of the road or decided, hey, I'm not wearing this anymore? Let it, be a piece of litter.
Yeah. I mean, if you decide that you want to clean it up, you should probably wear gloves if you're going to pick it up and throw it out, and make sure you wash your hands. I probably wouldn't advise you to do that. We have people who, the street cleaners and all that stuff who can, safely dispose of those things. But, you're right, because I take walks in my neighborhood and in parks, and sometimes I see people discarding their masks on the street, and that's ridiculous. I mean, you could throw it into the trash can. You're just creating other problems by littering these masks all over the place. But I mean, I don't think it's a good idea to pick it up. You don't even know what's been in that thing. But if you do decide to, please wear gloves and wash your hands after doing that. The general recommendation is to wash for at least 20 seconds to make sure you kill any virus in your hand.
The one thing you talked about on the show a few months back was how coronavirus can affect your organs. And we've heard all these different stories of, there's the antibodies, like, so if you've had it, that the antibodies may help. But we've heard all these different stories of how people have had it, and some people are getting, like, diarrhea, other people aren't. Everybody's getting a different kind of illness. I mean, the symptoms seems to, kind of been changing a little bit and how it affects people. And then, like, if they get it again, it's, like, different. So it feels like the virus is the virus mutating? It's like, I want to go to sci-fi world here.
Well, I mean, there is some evidence that it's mutated a little bit, but the symptoms have not changed. Remember, this is a novel virus, so we didn't know much about it. Everything that we're learning is from, patients who are exhibiting symptoms. We know today that the virus can affect every single organ system in the body. And as a result of that, people have differing symptoms, from pulmonary to GI to sometimes neurological symptoms. So we're learning that. So it's not that the virus is mutating and causing different symptoms. It's just we're learning more and more about this virus. So, yes, there are different symptoms that can be associated with the virus and that's because the virus has the ability to affect any single organ system in the body.
Mm. Wow. So if it can affect that and it can keep coming back, what do you think? What are you thinking right now? As a doctor, do you think we should not do you think we're being too free with this and running around and not wearing masks? I mean, when you look at the numbers, they look like they're going up, and then some places are going down. Do you think we'll ever get rid of it?
Well, I'm hoping so. Our case numbers keep rising. I mean, people are cavalier about this because we know that the majority of people who have the virus are asymptomatic or have minor symptoms, and the people who actually get sick is a much lower percentage. But still, you want to get rid of this virus from this environment or decrease the spread as much as possible because, one, you don't want to overwhelm the hospitals, and two, all of us have people that are considered high risk in our families. We have, I have an elderly mother who's almost 85 years old. Everyone has somebody in their family that's considered high risk. So just because you feel like you're younger and and that if you get the virus, you're going to be asymptomatic and nothing's going to happen to you, but you still end up affecting the lives of people you considered loved ones. And so you should take it seriously for that reason. Take it seriously for your friends and family members who are considered high risk, who, if they get this illness, they may actually pass away from it.
Oh, wow. One of the things we're seeing, too, is this discussion over schools. And it's interesting because we listen to all the different regional, radio shows as we travel. And every place is different in how the virus is. And it can change in the matter of days, though, like literally in the matter of days. Absolutely. When you're somewhere. But this discussion of putting kids back to school is, I think, it's scary. I would be really, really
I wouldn't
scared.
Send you to school. I wouldn't.
No, I know you wouldn't, Nancy. Nancy would be like, come on, you're going to homeschool and you're going to do some chores while you're at it. Nancy will put me to work. But this... I think it's not fair on the teachers. I think about, they say, oh, the kids can't get it, babies can't get it, but there's cases where they have.
Yeah.
So, and it's different even by country with that, from what I've heard.
Yeah.
So the school thing, I mean, any thoughts for parents, what they should consider?
Yeah, I mean, I think it should be taken on a, region by region basis because, some regions or some areas in the country may not have as high numbers as other places. And I think they really should use science in making a decision about whether or not to reopen schools. That's always the problem. We have, leadership telling us open schools, but not giving any direction on what to do or how to make it safe for the students as well as the teachers. And also no contingency plan. If there's an outbreak, what do you do and all these kinds of things. There's absolutely no guidance as to how to do this, but the mandate is open schools. I don't care how you do it. I don't care what happens. Just open it. And that is just not right. I mean, I think leadership should really help more in coming up with guidelines, looking at the science of cases in your area and deciding how you're going to proceed. So I'm hoping, that in the different regions or different states that, whatever leadership is helping make this decision is actually looking at the guidelines put out by the CDC or the task force and, following those guidelines as closely as possible.
Does the CDC have to? Yeah. I'm worried about the CDC part because I've seen people argue of whether they're necessary or not, and I'm like, that's kind of like our EPA, right? That the EPA, and sometimes you have to argue with the EPA because maybe we want them to be, not letting mining in a park, right? I'm just going on that, or don't let this pig waste go into this water, But a lot of times we need to have those, those institutions there, right? Like the CDC, aren't they the ones who control the numbers and everything?
Yeah.
Then isn't that kind of that been taken away, that power, or?
Yeah, I mean, they've been our regulatory organization that's why they were started, for the country. They're the ones that keep track of, the public health and the diseases and all those kinds of things. And, to have them not have access to this data and for it to go directly to the government without going to anybody else is kind of shady. But yeah, I mean, they've been the ones that we've been following, throughout our history or throughout their history. So I don't know why we should all of a sudden stop now using them. But yeah.
Yeah. Well, unfortunately, things get political, and there should be some kind of body that doesn't have anything to do with politics. Yeah, and then it goes to the funding. How do you get the funding? Then you have to go to the government, and then starts the politics.
Yeah. I think it is we have to really work regional, because I think everybody knows their community, where the community needs more help, like how the hospitals are. Everybody's different.
Exactly.
And I'm serious,
Everyone's
just
different.
being on the road and seeing each community being different. I mean, right now, we're in a township. We're not in a town. We're in a township. But it's very rural. And now they're starting to say, well, it's, rural areas are also starting to get it, which it didn't before. So, when we travel, we're incredibly careful. We wear our masks. We wipe our hands, wash our hands, with wiping, with the disinfectant wipes. If you're in a place and that's the only thing you can do. Traveling by car, you're kind of not in a group setting. And all the bed and breakfasts that we stayed in are really strict. You go in, and let me tell you, it's fun carrying your luggage upstairs with a mask on, but we do it. You do what you need to do, and you can.
Absolutely.
And I see all these businesses working together with the community, and the community people working together. Of course, there's the other side of the ones who don't and mock them, and so there's the anger side of the other sides of things. But as a whole, people want to get back to work, go back to school, go back to do these things. So it's really about, wear your mask, be socially distanced, wash your hands. And, I think if we just kind of obeyed those rules, things would get better, right, Dr. Jackie? What do you think of that? If we obeyed those ones.
I completely agree with that. Everybody wants, the economy reopened. Nobody wants it to be reopened as much as I do. But we can't unless we get these numbers under control, because we know that this virus is extremely contagious. So the only way we have to combat this virus right now is by decreasing transmission, by wearing the mask, by social distancing, and washing our hands as frequently as possible. This has been shown in studies to decrease the transmission. We don't really have any vaccines right now, so the only way we have to decrease this transmission is to do these things. So we have to do that in order to decrease this transmission.
I was thinking about the kids, and I think it would be possible to actually use, I know we're talking about like kids can learn online, but not every child has a computer or is computer savvy. But it could be possible maybe to use the radio or the television. So if look at regional television, so the television people need to make a slot for schooling of different ages, and to swap out the teachers or whatever has to happen. But to have a local, I know there's a local radio station, and I know there's a local TV station. So maybe those are the ones who should be doing the teaching and having the teachers come in and use those things that we do have.
Yeah, I mean, I think that it's something that we should figure out. Because we don't know how long we're going to be in this kind of environment, but it should be figured out. And it's funny that you brought that up, because I was just talking to my sister who's been, homeschooling her children and going crazy. But what she's noticed, though, is that, initially when we had the shutdown and all the kids had to stay home and do their assignments from home, it was all very disorganized, but now after the summer break and now school is resuming, she says everything is so much more organized in terms of online education for these junior high schools and high school students. And I'm like, that's great. You figure it out. These are these are unprecedented times. We don't expect everything to be 100% perfect,
Right.
but we can work with our situation, and we can, figure out how to make the best, of it. People keep complaining about online education is bad, but we need to figure out how to educate our children while we're going through this, and people can figure it out. You can figure it out. I mean, yeah. So, but it sounds like the teachers are more organized about how they're going to proceed with online teaching. And it's all good news. It's not where we're learning how to adapt to this situation, because we don't know how long we're going to be in the situation. So we have to adapt to it, and that's what we just have to do.
Yeah, exactly. That's the thing about the education, the online, and there was all this drama at the beginning of this. Everyone's complaining at how the education didn't do their job at the beginning. Well, there was no leadership on it in the beginning, and everybody scrambled to do what they could. Teachers had to. I mean, a teacher could be living in a rural area with no internet, and then suddenly it's like, hello, you must be doing this. You're doing online curriculum. It's like give everyone a break and let's work together. And I think the teachers have really, really tried hard, and the schools and the school districts have tried really hard. And Super Camp. You've been on the shows with Bobby DePorter. They have their Super Camp where it's teens and preteens go to stay on a campus for 7 to 10 days in the summer. And she turned it. They worked day and night and turned their entire Super Camp to be virtually online. And so this unified kids from around the world. It's more cost effective for the families, and they had online mentorship. So it was the group discussions, and I think that's pretty fantastic, because I think it actually opens up to more connections, and hopefully down the road those connections can be in person. But we just all have to do what we have to do right now, and I think all these virtual events are cool, and people are getting creative, and it's good to use that other side of our brain, the creativity side,
Exactly. Yeah, well, who knows? We may learn. I was going to say, who knows? We may learn a better way of doing things by, having to change our ways.
And, the sooner we comply with things that need to be done, the sooner we're going to get rid of this virus. So
absolutely.
If you're going to walk around and go shopping without a mask on, you are one of the people that are making this condition live longer and longer and longer. So please stop it.
I echo your sentiment.
Yes, everybody. Yeah, keep your mask on. And why people aren't masking their children? Is that wrong?
Yeah, I've seen a lot of that.
Yeah, they should. They should mask their children. I think they have masks now that actually fits children. They should. Yeah.
Yeah.
And that's the issue with that's the issue with that people have with schools, that you won't be able to mask children. Yes, you can. You can put it on. You should be masking your children, basically. Yeah.
Yeah. Think how much quieter they'll be.
There's going to be put a mask on it.
Yeah,
that's it.
Put your mask on.
Children should be masked and not heard. Oh, that's horrible. Oh my gosh. Well, thank you so much for keeping in touch with us, Dr. Jackie, and reminding us all to wear our mask. It's a public service announcement from Dr. Jackie.
That's right.
But you do need to still go and get your medication and see your doctors, and there's telehealth too, right? So that's the other part of it. So you can still stay in touch with what you need to do for your bodies. And that's the thing I look at this whole thing is we're overtaxing our grocery store workers, our healthcare workers. And, it's like, okay, the more cases we have of COVID, the less room we have in doctors' offices and hospitals. And so other people are suffering, not from COVID, but, like I know people who have delayed surgeries, and their surgery has been delayed for over 6 months. And that can't be good for them, So, because it's dangerous for some, right now to go and get a surgery done. I know that they're doing testing beforehand, but I think it's like, here, go to the place where you get tested at the place that you could catch it from. I don't know. It's like So I just hope everybody just wear a mask, wash your hands, and don't cough on each other. Or sneeze. But everyone, again, go ahead, Dr. Jackie.
Oh yes, I was going to say, and don't neglect your other medical conditions. Make sure, like I'm just re-echoing what you say. Make sure you're taking your medications. Make sure you're following up with your regular doctor's visits. Like Lisa mentioned, there's the option of telehealth if you are nervous about going into the office. But be reassured that most doctors' offices have implemented the CDC guidelines of mask wearing and just keeping people safe in general. So don't neglect your chronic medical problems.
Right on, right on. Thank you so much, Dr. Jackie. You stay safe. And Dr. Jackie, will you please put your mask on?
I have my mask on. What are you talking about?
I know you do. I know you do. Everybody, again, Dr. Jackie's book is Women in Heart Disease, The Real Story. And you can get it on her website, womenandheartdiseasebook.com. And also keep up with her on Facebook. And also go to her website for her offices and to set up a meeting with her there if you're in Southern California, or telehealth. Go to cvwellnessinstitute.com. And, again, go get her book. And every woman needs to read that book. And everybody needs to, because everyone needs to know what's going on with the women in their lives, their health, right? So sons and fathers and brothers, you need to know too. So go get it. womenandheartdiseasebook.com. Take care, Dr. Jackie.
Take care.
Bye-bye.
Bye.